This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
Okay, quick medical minute on the differentiation or algorithm that we should follow when dealing with a patient who comes in with a wide complex tachycardia. So do you guys know what I'm talking about first off when I say that? Whether someone's got a wide complex tachycardia? Okay, so there's two basic diagnoses that we're talking about here. One of them is fairly benign. The other one is very scary. So those two diagnoses are going to be the benign one, which is basically SVT with some aberrant conduction. So SVT with aberrancy, meaning they have SVT, but they have a right bundle branch block or a left bundle branch block. And so it's super fast, but then also it's wide because of their block. That's not scary. The other one is VTach. VTach is scary. So it's important for us to kind of tease that out and figure out which one it is. And just probabilistically, if you don't know anything about the patient, nothing, if you see an EKG that is wide complex tachycardia, does anyone know what the odds are that it is VTach versus SVT? So you don't know anything about the patient, just wide complex tachycardia. It's 80% chance at least. It's VTach. So if you don't know anything, just random guess, it's 80% chance it's VTach. If the patient has a history of coronary artery disease, it's over 90% chance it's VTach. Odds are it's VTach, and VTach is way scarier than SVT with aberrancy, and the treatments are super different. So if you're thinking, maybe it's SVT and they've got a right bundle, I think, and you start giving them DILT or give them adenosine, and it is VTach, you could totally kill the patient. It's a very, very dangerous thing. If it is SVT and instead you give them amiodarone or lidocaine, it's really not that bad. So basically, the take-home point is essentially it is VTach every time, and don't even think about SVT with aberrant conduction until proven otherwise. We can deal with that later, but it's VTach, it's VTach, it's VTach, and don't worry about SVT with aberrant conduction. The only time is if you look and they have a history of a known left bundle or right bundle, and it is the exact same morphology in every single lead, and they otherwise are completely fine, then you can maybe say, okay, it's SVT with aberrant conduction. Otherwise, VTach until proven otherwise. All right, don't have any questions about it? Yes?
Is there a reason amiodarone is more in vogue than lidocaine?
That's a good question. Is amiodarone, why is it more in vogue than lidocaine? I would say it's probably more cultural than anything else. Amiodarone works on like 5 different receptors, and lidocaine is usually only on one. I don't have a good reason for it other than I think it's just what people are more comfortable with, but they're both totally available. One of my toxicologists that I trained with, he went an entire career without ever giving amiodarone, which I thought was pretty crazy.
I've never given lidocaine.
Yeah, we can do it. It works. It works. It works. Yeah. Yeah. The half-life of amiodarone, by the way, is 52 days. Just as a fun fact.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.